vaccines, not just vaccines, but overall developments around COVID-19. Dr. Joe Phaahla, the National Minister of Health, is speaking.
And who are going to give us an update in terms of how the vaccination program is going in the Northwest, and all other panelists who will be here, members of the media, the viewers. We also have Dr. Lungi, who's going to give us about the workplaces, and I'll also introduce another special guest. Members of the media, our viewers, listeners, all South Africans, good morning. Dumelang. It's our pleasure again and privilege this morning to be back to share with all South Africans the progress and challenges in the fight against the COVID-19, the invisible enemy which is ravaging the world and our country. I am pleased to report that we are steadily getting out of the grip of this third wave of this COVID-19, which, as we've mentioned many times, has been driven by a variant called the Delta variant. Nationally, there has been a 24% drop in new cases compared to the previous 7 days. Over this period, the highest case incidences have been in the Northern Cape province, which remains really protected in terms of COVID-19 infections. The Northern Cape has been followed by a case incidence, the rate of case incidence by its neighbor, the Free State province. And you can understand because they are very close to each other, and the people move in between the two provinces. And then the KwaZulu-Natal province has also been still very high in terms of the case incidence. And this is the number of cases on a daily basis per 100,000 population. Over this period of 7 days, hospitalization has also gone down by 10%, which is good news because it means less pressure on our health services and less pressure on our health workers, with the Western Cape still having the highest hospitalization rate per population. And the Western Cape is followed by Free State and Gauteng. So we'll see that notwithstanding the fact that the cases per day in Gauteng, if you compare with about 8 weeks ago, have drastically dropped. But the hospitalization, because hospitalization follows the infections, often when people get infected, it takes sometimes days and sometimes even weeks before they can be sick enough to get into hospital. And that explains why Gauteng is still having a pressure in terms of hospitalization, although it's really gone down, as I said, overall nationally by 10%. Now, if we go to the last 24 hours, yesterday we recorded new positive cases of 6,270 in total, which is again consistent with a downward trend, because when you look at the previous 7 days average, it was well above 8,000. So 6,270 is quite a good downward trend. But surprisingly, the highest number of cases were recorded in the Western Cape. That is 23.6% of those new cases were recorded in the Western Cape. I'm saying surprisingly because a few days earlier, the KwaZulu-Natal province, which came out yesterday at 19.5% of that total, has been the highest above the Western Cape. And the Eastern Cape came at number 3 last night at 17.8%. So, but nevertheless, the trend of the highest rate of infection still remains along our coast, even though, as I've mentioned, instead of KZN being the one which has been leading, yesterday it was the Western Cape. Active cases were the highest in the Free State and then followed by the Northern Cape. Again, as I said, these are the two provinces which are still a problem. and then followed by KwaZulu-Natal and the Western Cape.
Recording in progress.
We are very happy indeed that the positivity rate is encouraging as well, because the positivity rate has come down. It's coming down steadily every day. It's come down from the highest levels in mid-July, at which time we were at the highest of 35% of positive specimen per test, to now, by yesterday, we're at 12%. Now, we're still a long way to what the WHO recommends of at less than 5%. Now, Gauteng, again, very encouraging. Gauteng, as of yesterday, was down from mid-July highs of about 30%. As of yesterday, Gauteng was the only province which had actually reached the recommended WHO lowest level, below 5%. Gauteng, as of yesterday, came out at 4.4%. And that's, as I've said, that's where we need to go as a country to meet the WHO recommended stability in terms of new infections. So Gauteng is leading the pace in terms of drastic reduction in new infections at 4.4% as of yesterday. Gauteng and Limpopo provinces have also exited the third wave officially. And we hope that the other provinces will follow suit. But I must emphasize that, as I'm indicating, this steady decline in weekly, daily infections, infection rates, hospital admissions, there is still no room for complacency, because as I've mentioned, 12% of positive rate is still very high, and it still means that we are still in a lot of danger. So we have to continue making sure that we keep safe. We must again take this opportunity to thank our health workers for keeping up the gallant task of saving lives on the front line. We know that they are not only saving our lives from the COVID-19 pandemic, but the other burden of disease still remains with us. Violence and injuries, motor vehicle accidents, non-communicable diseases, infectious diseases, all this quadruple burden of disease still remain. And we are indeed very proud of our health workers for keeping us safe in these very difficult times. Sadly, we continue to lose many more South Africans to this pandemic. And as we would have seen from the announcement by the NICD, as of yesterday, as a country, we have lost 84,327 South Africans to this invisible enemy. So may their soul rest in peace. We know that these are family members, friends, co-workers, and it's indeed very sad that as a country we have lost so many people, but we are aware that if it wasn't for the sterling work of our health workers, the death toll would have been even higher. On the vaccination side, the campaign is maintaining a very steady momentum, but I must say it still needs to gather more speed if we are to actually reach our targets. We are very glad that we have in our panel today, as I said, I will introduce one of our panelists, a well-known TV personality, who has agreed to come and share her story of struggling with comorbidities, and then on top of that, struggling with the COVID-19 infection and recovering from that, and ultimately being able to obtain a vaccination. We thank Ms. Karen Mon, who will be speaking to us later on. Workplace vaccinations are also playing a major role in our campaign, and we'll hear more about this from Business for South Africa. I've mentioned that Dr. Lungi will be there to give us an update in this regard, which has been the B4SA, Business for South Africa, has been coordinating workplace vaccination. Now, this is an alliance of various volunteers working with government and social partners, largely from the business sector, to mobilize the colleagues in the business side for resources, and also to build capacity in our struggle to combat COVID-19. And I must say that especially in the work of rolling out the vaccination, B4SA has been a very reliable partner working with other social partners. As of yesterday, when the vaccination stations closed, we had vaccinated just over 225,550. We've administered just over 225,550 doses, which is still far short of what our president has put as our target of 300,000 doses administered daily. But also, when we consider the fact that this 225,000 doses also include second doses of the Pfizer vaccine. So it doesn't necessarily translate into the 225,000 individuals, whereas in fact, we would have been happy to be vaccinating up to 300,000 new individuals every day. So we still have a lot of work to do, all of us together. The total doses administered as of closure of the vaccination sites yesterday, we reached 14,367,000 yesterday, with the total number of individuals vaccinated standing at 10.5 million, 10,510,000. These are individuals with a minimum of at least one dose of one of the vaccines. Now, this constitutes 26.4% of the total adult population. And out of the 10.5 million, just over 7 million and 21,000 people were fully vaccinated. That is either with a double dose of Pfizer or single dose of Johnson & Johnson. Now, this constitutes 17.64% of the adult population of everybody in the country above 18 years. We still need to reach, therefore, if we're going to reach 70% of the 39 million South Africans, we still have to reach another 18 million more adults to achieve the 70% coverage of all adults with at least one dose by middle of December. Now, the encouraging news will be that once we get more doses of the Johnson & Johnson vaccine, we should be able to increase the numbers of those who get fully vaccinated, because once we use more of Johnson & Johnson, it will mean that every single dose will be constituting full vaccination. As far as the gender proportion in terms of the vaccination, our female clients are still coming out in bigger numbers, standing now at 57.7% of the females who are vaccinated, as compared to the males at 42.3%. So we still have a lot of work to do to get all the men to come out to receive their jabs. We have taken note of complaints of delays in receiving of SMSs to confirm bookings. And today we're able to announce that we have activated the self-booking feature on the electronic vaccination data system. What this means is that you can select as you register on the electronic vaccination data system, you can from now select a date, time, and vaccination site of your choice. You go onto the site, which is vaccine.booking.health.gov.za, and then you can be able to book yourself. Unfortunately, that does not mean, many people have been asking this sometime as we interact with members of the public, whether as an individual you can also choose the vaccine. At the current moment, as we know that we're using the Pfizer and the J&J. Now, unfortunately, it's not possible at this stage for every individual to choose which one of the two vaccines. And in future, if we add more vaccines at this stage, unfortunately, because we are controlled by availability of stock. I know that in some stations where I've been, they have been offering people a choice, but not everywhere, because it depends on the supply of the day. Now, I want again to assure everybody that while you will not always be able to choose for yourself, but both vaccines are very safe and effective, so you don't have to worry if you are informed that on that particular day, on that particular station, there's only Johnson & Johnson or there's only Pfizer vaccine. These are both very safe and very effective. We are also aware of the debate around a vaccination passport, which is required by some countries for international travel. In our country, we've not yet gone that route. We only require a less than 72-hour-old PCR COVID-19 test for either people leaving the country or especially entering South Africa. We have, however, commenced with the development of a digital vaccination certificate to confirm that a person has been vaccinated. We have made sure that this certificate will be protected from fraud, and this certificate will be able to be uploaded on your smartphone, and it can be printable. This initiative, we must also mention that is in line with the World Health Organization initiated vaccination certificate. Through this, the WHO is attempting to standardize vaccination proof all over the world so that this cannot be defrauded in terms of proving that you've been vaccinated. So we're following in the standard which has been set by the World Health Organization. So in a matter of maybe just over a week, this vaccination certificate should be available to those who are vaccinated. I must also mention, I know this question has been asked in some of the interactions with members of the public. Once the certificate is available, it will be available even for those of us who vaccinated a few days, few weeks ago, few months ago, as long as your particulars are reflected on the EVDS system, you will be able to obtain this vaccination certificate. And we must warn fraudsters who wants to produce fraudulent certificates. We know that in the future this may be useful in terms of accessing various services. But again, I must add that we have no intention as government to require people in future to produce these certificates to access public services. They may be useful for access to some entertainment, sports, and other events, but definitely not essential services, not public services. So we want to emphasize this. We know that the local elections are on the horizon, as announced by the IEC following the Constitutional Court ruling, and also now a date has been set by the Minister of Cooperative Governance, Dr. Nkosazana Dlamini-Zuma. These elections, as we know, will take place on the 1st of November. Our aim is to integrate the registration weekend, which is the 18th and 19th of September, as announced by the IEC. We want to integrate this with the vaccination campaign. Our current target for vaccination is the very same age group, 18 years and over, as the voting age group, which is also 18 years and over. And therefore, there is very good alignment in this regard. We advise voters and candidates to be vaccinated to ensure that we have a safe local government elections on the 1st of November, both for the voters and the candidates. We will be working with the IEC and the political parties. And yesterday, the president led a meeting in which there was consultation with the political parties to discuss safety measures as we go into these local government elections. And we did appeal in that meeting that we would wish for a very fruitful collaboration between ourselves and all the political parties, both during the registration weekend and also as all the parties hit the ground on the campaign trail. We indeed hoping that we'll have very good cooperation for the protection of all citizens. We are pleased with the initiative by the Deputy President and the Minister of Sports, Arts and Culture, the Return to Play campaign, which was launched this week on Wednesday. We believe that this Return to Play campaign constitutes a first step to reopen places of sports and entertainment. We are looking forward to a very vibrant campaign working with sports stars, music legends, and all other arts and culture personalities to promote vaccination, which will lead to better safety. And we're very optimistic that this will be able to help us to lead into gradual reopening of stadiums and other places of entertainment. We must remember again that the vaccines which we are using have been well tested, and as I've mentioned earlier, are very safe and are very effective in terms of preventing serious illness, hospitalization, and even possibility of dying from the virus. We urge everybody not to be confused by those who are campaigning against vaccination. The record in terms of prevention of serious illness by these vaccines is proven beyond any doubt. Again, we can say to you that our health workers are very good proof that this is very effective. Also from the various statistics which show that even currently in our ICUs in various hospitals, vast majority of those who end up in hospital and especially in ICU, by huge difference, those who end up in ICU currently are those who have not been vaccinated. So I want to assure all citizens that indeed the stories about the vaccines will kill you. Yesterday, as we were with the Deputy President interacting with the public in the Bujanala district, we came across still people with this kind of information which we're able to clarify. A brighter future lies beyond this COVID-19. It is possible if we all work together. Let us all play our roles. We can defeat the COVID-19 pandemic. I thank you, Facilitator.
Thank you, Minister, for a comprehensive update as far as the vaccination is concerned. Indeed, we urge our people to exercise their constitutional right of voting and vaccinate at the same time. So it's VV. The first V is to vaccinate. Second V is to vote. Thank you, Minister. Without wasting any time, I'm going to call upon the MEC for Northwest, MEC Madoda Sombata, to give us an update as far as the vaccination is concerned from Northwest Province. We've been inviting a number of provinces to share with us the best practices, the challenges, the plans on how they're going to ramp up the vaccination so that we'll be able to make sure that no province is left behind, because until we're all vaccinated, until all provinces are doing well, we'll be able to progress as a country. Over to you, MEC Sombata.
Thank you very much, Facilitator, and thank you very much to the Minister and the Deputy Minister and all South Africans. In Northwest, I'll just give a background and then the Administrator will make a presentation. As we speak of today, cases we have in the province, it's 146,060 from the start of the case reported, as we know. Those that have recovered, it's 135,007. Those that have died, unfortunately, it's 3,932. And the active cases, it's 7,121. New cases, 356. Of course, like the Minister had said, the number is going down like any other province. In this number, 180,000 contacts were registered. And these contacts were then traced, 177,000 of them, 99% were traced, 60,000 were tested. And in the tested 60,000, 24,000 of them tested positive. And as we speak, those that have finalized their 10 days quarantine and isolation, it's 148,000, which means we're doing well on the element of contact tracing and management of cases. As of yesterday, we administered 753,000 vaccines. Yesterday, in the program of vaccination, we did 13,696, which is less than 20,000 as our daily target. Let me request that you allow the administrator to take us through the presentation for Northwest vaccination. Thank you very much.
Good morning, Minister, Deputy Minister, MEC, my colleagues, other panelists, and the facilitator. I've got a brand new computer and it seems like it's not set up properly, but thankfully Dr. Chris is assisting me and he's got the presentation up. Next slide, please, Dr. Chris. So the purpose of the presentation, I've got 10 minutes in which to briefly share with the audience our progress in terms of our vaccination program in the Northwest Province. So we'll talk about the current status, the strengths of our program, our challenges, which actually at the moment is only one, as I will share with you. And then the strategies to increase registration and vaccination, and then our conclusion. So as at yesterday, the Northwest Province has vaccinated 576,511 people, and that brings us to a percentage of 21.4% of our total population, which we have vaccinated. Next slide, Dr. Chris. For us to reach our target in terms of having vaccinated enough people in the Northwest Province to be able to reach population immunity, we have to, between now and December, vaccinate at least 20,000 persons per day over a 6-day week. This is an ambitious target and it's greatly dependent on the mobilization for registration and vaccination. Because as I'll share with you, our key challenge at the moment is vaccine hesitancy, but we believe with the national mobilization supporting the provinces and with the provinces' own mobilization drive, we could push to get to this ambitious target. Our strengths are that we have 55 fixed sites, 42 public and 13 private. And we support that. I'll show you on the next slide how these fixed sites are distributed, at least the public sites across the province. And you'll see that, especially in areas that are like the Vryburg area, the Dr. Ruth Segomotsi Mompati district, there are quite a few gaps. The gaps we support by outreach sites, and we have 200 smaller outreach sites. And these are belonging to the health sector, private and public. But there are also sites from business and other industries. We've got the human resources we need for what we are operating at the moment. We've got all the equipment that we need. We've got the support from provincial treasury, the provincial executive, which includes other government departments. We've got the support of the National Health Council, private sector, academia, and NGO partners. We've started to mobilize and we're getting support from religious and traditional leader sectors. Civil societies really come to the fore in the Northwest Province, and we are also supported by organized labor. This is the distribution of the public sites, as I've said, and there where we have gaps, we are supplementing these with satellite sites, both public-private and in both public-private health and in the business sector. Next slide, Dr. Chris. Our biggest challenge is vaccine hesitancy because, with issues like human resources, staff do get sick and you need to find other staff to take their place. We are assisted. Our provincial treasury is really our biggest partner in this, the rollout. We are assisted with the ability to contract staff on contract basis. And then also we get the equipment that we need, but we need the people to register and we need people to come to be vaccinated. Next slide, Dr. Chris. So I have spoken about the fact that we need to vaccinate 20,000 people per day. And so as part of the strategy, you can go back to that slide. Thanks, Dr. Chris. So as part of the strategy to reach this, we are doing a daily monitoring. Because of time, I'm showing you the provincial overview, but we zoom in to every site and see how their numbers aggregate into sub-district, how sub-district numbers aggregate into the district, and finally into the province. So you can see we are quite a bit short of that 20,000 per day target. We're currently averaging about 13,000 people per day. And this graph shows how we've done for the past 8 days. And there where it takes a dip is last Saturday and Sunday. We do have some sites open Saturday and Sunday, but it seems like we have not yet mobilized people to take up this opportunity. Next slide, Dr. Chris. We do as I said, daily monitoring, and then we have a meeting where we do an evaluation of what happened the past week, because we set targets for the week forward for every site, which again will aggregate into sub-district, district, and province. And in terms of our last weekly evaluation, you will see that our problem is the number of people who come forward to register. In the 18 to 49 years group, only 19% of those targeted have registered, 50 to 59, only 34%, and then 60 years and above, only 59%. You can see that because our target is that we vaccinate 70% of those eligible. The target is 70% of the population, although we will push to go higher. You can see that we are doing fairly okay with the number of people vaccinated out of the registered. We can still do better, but really our problem is to get people to come forward to at least start to register. And many of our sites do take people, register them at the same time and vaccinate them. So you don't, turn people away to register, but there's home drives into the community and into homes to get people to register now. Next slide. Our strategies for improving our current performance are as follows. We're increasing vaccination sites progressively. We're aiming for 70 public sites and 22 private sites. And we want to establish 8 max vaccination sites. We already have 4 operational, the one in Moses Kotane, the Sun City one. We've got a large mass site in Klerksdorp in partnership with the municipality. We call it the Jade Square site. And then we have 2 sites with the Northwest University, the one at the Mabatu campus and the other one at the Potch campus. And the Potch campus one particularly operates on Saturdays and Sundays. We will continue to provide education specific about the vaccine so that our population get to know what the vaccines are about in an attempt to dispel the myths around vaccination. We intensified campaigns to improve registration through deployment of registration teams to local municipality wards, establishing stations at strategic areas where people congregate, house-to-house registrations, and registration at all health facilities. We have and we continue to engage with the religious sector for increased reach of the congregants and to assist to dispel myths. As the minister has indicated, ministers spoken about influences at the national level. We are also working with our local celebrities and especially the biker community to dispel myths. Next slide, Dr. Chris. Yes, intensified communication directed to target the young adults using appropriate channels, including social media, podcasts, and posters, because that grouping of 18 to 34, we have clumped them 18 to 49, but we do keep an eye, just for the presentation's sake, I've done that, but we keep an eye separately 18 to 34 and then also 35 to 49. The group 18 to 34, we are doing particularly poorly when it comes to registration, so we are out to target them specifically. I've spoken about the influencers and the biker community, setting up registration and vaccination sites at strategic points, including institutions of higher learning, malls, and libraries. And we are sharing our resources currently with the mines, municipalities, academic institutions, and businesses. We've got good cooperation in that regard. In conclusion, we recognize that our targets are steep, but they are necessary to reach population immunity in good time. We can't drag our feet and wait too long to reach that critical level of immunized people in order to stop the continuous infections of COVID-19 in the community. And if we continue to employ a whole of society approach, as we are currently doing as South Africa, we will reach these targets. Thank you, facilitator. Thank you for this opportunity, Minister.
Foster, you are on mute.
Thank you.
Foster?
Oh, I was not aware. Yes, sorry. Yeah, thanks, colleagues from the Northwest Province, led by the MEC Madoda Sambata, Ms. Jeanette Hunter, on the presentation as far as the province is doing with the vaccinations. As the minister has already said, that we will not win this war against pandemic if we only work as the government, but we want to appreciate the efforts by the business sector, the civil society, and other sectors of the society who have joined hands with the government to ramp up the vaccination. So I'm going to hand over to the representative from Business for South Africa, Dr. Lunginyati, to tell us how are they doing as far as a sector to assist the government. Over to you, Doc.
Thank you, Foster. Good morning, everyone. Thank you, Minister and Deputy Minister, for the opportunity to share some of this work, which you know very well, because we've been partnering with the National Department of Health since 2020. I'm just going to talk about what we've been doing as the workplace vaccination work stream in terms of the National Vaccination Program. I won't spend much time on this because the Minister has really spoken about this already, but the partnership between Business for South Africa and the NDOH is rather expansive. We have 5 work streams that we have been working together with the department regarding vaccinations. You'll see there right at the bottom, service delivery platforms is one of the work streams. And in the service delivery platforms, we've got 3 sub-work streams. One relates to the health-based vaccination sites, so pharmacies, hospitals, as an example. Then there are mass vaccination sites that we're working with the various provinces on those sites. And lastly is the workplace vaccination sites, which is what I'll be speaking about. We have other work streams, and I just want to highlight the portal where we have built a model as the private sector that includes both private and public sector sites to understand where the demand is in the country, and then be able to direct some of the thinking of the various sites about where they can set up additional capacity where there is a lack thereof. So I'm going to move straight on to the workplace vaccination site program. The private sector, as you know, had intended to provide capacity of over 100,000, and as things stand right now, we have capacity of over 150,000, 150,000 vaccinations per day that can be contributed by the private sector. In there, we have the occupational health sites that have set up vaccinations in workplaces. Those occupational health sites are those that have existing occupational health capacities, and they were able to set up vaccination sites. We've soon learned at the beginning of the program that not all workplaces have these OHS facilities. And so we knew that we would have to end up having various models for vaccination of workers. But if you see there in that graph, we've just highlighted how every province has been able to be accommodated where there are fixed occupational health sites. And they've vaccinated over 250,000 in over 82 sites. There are about 20 more sites that are going to come into play. As I've mentioned, we needed to then pivot for other workplaces that were interested in vaccinating their workers in the workplace but didn't have an existing occupational health site. And they've put in place different models. As an example, there are some who have partnered with existing sites, whether it was a pharmacy or a hospital, or even existing occupational health sites, and the various provinces to enable further vaccination of employees in those areas. And I'll give you examples of that just now. Then there were programs that were run for essential sectors, and these were run together with the public sector as well as the private sector to enable a swift vaccination of these essential sector sites. And those were run in existing sites, some of them where they were able to bring some of these workers in an existing site and get these workers vaccinated at specific hours. And then some were able to have mobile services that go there. In fact, right now, I think the mobile outreach services that have been done by pharmacies, hospitals, some OHS providers, as well as non-medical providers, are now the biggest proportion of workplace vaccination programs. So here is an example of what the occupational health sites look like. There are 52 of these sites in the mining sector alone. In fact, our very first workplace vaccination site was in the mining sector by Phaahla, and they've done really well. They've vaccinated over 80% of their population in some of their mine shafts. What you see in the bottom right picture is the mining sector has also set up some programs to vaccinate their communities, and they've set up specific spaces to vaccinate communities as the mining sector, and we've started to see some workplaces pivoting to be able to do that as well. We do have, though, some sectors that are not doing so well, and we've seen that there is a vaccine hesitancy, as Dr. Hunter has mentioned, even in the workplaces. But some of these sectors that have set up fixed sites span not only mining, but include the automotive sites, the telecoms community. The taxi industry has really been great in offering vaccinations to the informal sector. We've seen the SOEs participating, and then various other sectors have participated in setting fixed sites. Obviously, there are some of these sectors that are sending mobiles to their employers. And we're excited really about the ability to vaccinate the community from existing workplace sites. As Dr. Hunter has mentioned in the Northwest, in fact, Dr. Hunter was the first province that we started speaking to in the Northwest, but we've seen provinces really taking the lead in engaging the various workplaces that are running vaccination programs. I'm showing you here an example of some of the partnerships that have existed in the Western Cape with other organizations where the private sector, including workplace sites, are contributing to over 27% of the vaccine coverage in this province. And that has required engagements across sectors, not just the health sector. And we've seen the private sector really come to bear to assisting setting up various programs in the provinces. Then the last program that I wanted to just highlight is the mobile vaccinations to workplaces. Here so far, more than 300 workplaces have been served. And what's great about the mobile vaccination program is that we've been able to reach the rural community, the small businesses, the factories that would not necessarily be able to set up a site, because setting up a fixed site has its own costs, and also one has to consider the pack sizes of the vaccines. And so the various existing providers, especially pharmacies, have been great, and hospital groups have been great in sending mobile vaccinations to various workplaces. So farms have been able to be reached, churches, factories I've mentioned, and there are some partnerships with some of the professional services like law firms as an example. What I liked about this picture, it was done by an independent community pharmacy where they were able to assist. CIPLA was one of the organizations that was burnt down during the KZN riots, and they were able to assist all of those employees be vaccinated at an independent community pharmacy in KZN during that time. And these kinds of collaborations we've enjoyed being a party to during this program. I'm going to end with this slide where I want to really emphasize that employers really have a key role to play in the vaccination program going forward. And as before, we've really spent a lot of time giving employees some guidance on who's vaccinated, and will continue to do so. It is critical that employers take some action in driving demand. There are a lot of reasons why various employees are hesitant to get vaccinated, or some of them are actually sitting in the fence and are not able to get vaccinated. And we're just offering some guidance on how employers can improve vaccination of their employees. One of the most critical ones is education. We found that some of the sites where we have gone to vaccinate workers, there was still a lot of lack of education. The resources have been now made available in all languages. They've been standardized somewhat, and it's been a great collaboration between the communication stream in B4SA with the GCIS, as well as the communication streams in the national department. And you can access these resources from the B4SA website and then customize them for yourself, as you see there as an example in those pictures. One of the critical things is to give workers time off to vaccinate. We found that to be one of the inhibiting factors, and the mobile program has really assisted with the third point, where it's not possible for some of the small entities to have their employees actually leave the premises. The workplace vaccination site makes it then possible to have it easy for employees to get vaccinated by bringing the vaccines to the workplace. And then I think it's important that workplaces consider providing their own incentives or linking to some of the incentives that are already in place. As an example, we, as you know, that SAFA has been offering discounts to those that are vaccinated. That's a great incentive. Some restaurants are offering discounts to those that have been vaccinated, and linking with those incentive programs is one of the key ways employers can drive demand. Then there are some key steps that the employers can consider at this stage. Maintaining capacity where they already have workplace vaccination sites is critical. Now is the time to really ramp up. As the Minister has said, we need to speed up our efforts. There's a Department of Labour gazetted guidance that's been issued regarding the potential of making vaccines mandatory as a workplace site, and it gives some guidance on how this can be done responsibly. So I think employers should read that and make decisions for themselves on how they can participate from that regard. And then obviously employers can expand to communities where they've finished vaccinating their own employees. It is critical that executives make decisive decisions, decisive measures on what they're going to do, and it does require active decision making. The B4SA has been involved in making sure that reimbursement guidelines are in place, and an employer can be assured that where their employees are insured, they can claim from the medical schemes, and for those that are uninsured, there are processes by which the National Department of Health is willing to assist employers claim for their uninsured workers. It's been fabulous to see that some employers are not claiming at all and are paying in full for both their insured and uninsured workers. And so employers can really participate if that is one of the things that they're wanting to do. And then lastly, I'll just say that we have provided teams both in B4SA as well as within the Department of Health to assist those employers that are wanting to set up actual sites in their workplaces, and then those that want to link up with existing vaccination sites. We also offer some guidance on how to do this. There's a lot that's available on the B4SA website to assist employers, and we really do want to encourage employers to play an active role in vaccinating not only their employees, but the public as well. I'll end there, Foster, and take questions when the time comes. Thank you.
Thank you, Doc. You can move the slide. Dr. Nyati, can you remove the slide?
Oh, I thought I had. My apologies.
Okay. Thanks,
Thank
Dr. Nyati. Yes, thanks, and thanks to all your colleagues and other volunteers who are part of the Business for South Africa Alliance. We believe that through your efforts, we're able to push more numbers by taking this vaccine to the people as part of the government campaign to take services closer to the people. And we believe that this is also working not only for us as the government, but also for these companies, because employees, they don't have to take a leave day to go and vaccinate because the vaccine is just on their doorstep. Without wasting time, I'm going to invite our special guest, Karen Mon, who's the survivor of this pandemic. Just to introduce Karen Mon, she's a South African journalist or legal reporter who's best known for breaking news stories on high-profile and criminal court cases. So over to you, Karen.
Thank you. Can you hear me? Thank you.
Very well, thanks.
Thank you so much for this opportunity. It's very strange for me to be on the other side of this kind of arrangement, because normally I'm the one reporting, but I feel very strongly on this issue, and I really appreciate the opportunity to talk about vaccination and how I believe it saved my life. I have been a type 1 diabetic since I was 4.5 years old. As a white woman from a privileged background, I've always had access to very good medical care, private health care. And so, I have experienced a lot of health challenges. I need to inject myself 3-4 times a day, take blood tests, monitor myself when I get ill. But I have been able to get very excellent health care when I have had health challenges. That doesn't mean that I haven't had some profoundly adverse experiences as a consequence of being diabetic. As a child and as an adult, I have ended up in hospital with, with things that started out as colds. I ended up needing oxygen and having to be hospitalized. So when COVID happened, I was absolutely terrified, and it had a huge impact on my family because obviously they knew with my comorbidity that I was vulnerable. And so when COVID happened, the initial phases, I basically lived in lockdown. One of my friends came to live with me so that she could go out and get us food, but I didn't interact with people because of the level of terror that I had. When the vaccinations became available, for my age group, I literally registered on the same day and got vaccinated. Subsequent to that, with symptoms that didn't present as COVID at all, I began feeling very unwell and I had to be hospitalized. And when I was hospitalized, they tested and found that indeed I had COVID. And I remember at that time, and I think this is an experience for a lot of us, having lost a lot of people, I remember starting to cry because I was really, really scared. I don't think anyone who has ended up in a hospital in those circumstances know the kind of level of fear that you have. But I didn't really expect myself to get so emotional. But I really honestly believe that having that vaccination helped me. I know 2 friends who are diabetic, both had type 2, and were unfortunately unable to get vaccinated and didn't survive. And there are many, many people in that circumstance. And honestly, until you're there, until you know the level of kind of panic that you have about what's going to happen to you. I wouldn't wish that on anyone. I don't want people to get COVID. I don't want you to struggle with the kind of unforeseen consequences of this illness. And it is so preventable. Vaccination really does work. And it's not something, the data is overwhelming. I mean, Kritiske recently releasing statistics that 3 out of something like 166 people in hospital at the moment were vaccinated. All the rest were unvaccinated. And it's such an easy and perfect way of putting yourself out of the line of fire. Because it's not just about you. I remember when I was ill, my family members and people who cared about me, people who care about you, they start panicking because they're so concerned about the outcomes. And so many people were reaching out to me at the stage when I was really not in the best shape and genuinely concerned about me. But after 4 days, I started recovering. I didn't have the symptoms where I couldn't breathe. My oxygen saturation levels were excellent. At no stage in that hospitalization situation was I ever in a circumstance where my life was in danger. And that is because of vaccination. And I would just urge people, really, please be responsible with the information that you share about vaccination. Please think long and hard about if you forward videos that claim that it kills, when there is so much evidence that this is something that preserves life in the vast majority of cases. So let's be responsible. Let's get vaccinated, and let's put out the correct levels of information about this so that people can be safe. So thank you for this opportunity, and I really appreciate the chance that I got to talk about this. And yeah, thank you.
Thank you very much, Karen. Very inspiring, and I'm hoping that our viewers and listeners and the public out there are getting the message. I'm sure it takes a lot of courage to come and share personal experiences with the public. Back to you, facilitator, Mr. Foster.
Thanks, Minister, and thanks to our special guest, Karen, for agreeing to come here and share your experiences publicly. We know that we've been trying many people to come and share this kind of testimony, but they don't have that courage. They don't feel free to come forward and talk publicly. But we believe that your message is going to encourage other people who are living with the underlying comorbidities. Because when we move around, when we encourage people to vaccinate, you will hear others say, no, already I'm living with HIV, I'm living with TB, I'm diabetic, I don't have to deal with another burden. But unfortunately, COVID-19 does not discriminate. It doesn't care whether you are living with another disease. It can affect you, it can infect you at any time. So we believe that people who have listened to you will be able to not waste their time, but go to vaccinate to save their lives, but also the lives of those who are living with them. Without wasting any time, I'm going to, we have at that moment where we interact with the media, they raise the questions, we try to respond. But it looks like by now we don't seem to be having many questions. I've got only a few questions that I've received directly through the WhatsApp group. I'm going to raise them while we wait for the journalists and other people to raise some of the questions. And the first 2 questions that I have, they read as follows. Number one, I see now the questions are coming. And number one, say people are concerned about manual capturing of vaccine registration, because when they go for their second jab, especially those who got vaccinated with the Pfizer, when they go for the second jab, they're unable to get the second jab because the system does not recognize them, meaning that according to the system, they are not yet registered. They've not even received the first jab. So because of the manual capturing of the registration. So the question is, what is the department doing about this? Because there are few people who are unable to get the second jab. The second question I see looks like it's been answered already. How many health professionals have lost their lives during the pandemic, and is the government planning any form of compensation for the families? We'll take these few questions for now while we are waiting for others. Minister and colleagues.
I think the questions, I would invite other colleagues to take the questions. On the first one, either Dr. Nicholas Crisp, or if there's anybody else on the manual capturing, I think let me allow any of the colleagues to take the question. Thank you.
Morning, Minister. Morning, Deputy Minister, colleagues. So on the manual capturing, this is a challenge. Out of the 13.5 million vaccinations that we have done, there are several hundred. In fact, it started off as thousands that were captured on paper. It was during the time of the scale-up of the large scale-up of the vaccination sites, and I think many site managers weren't quite familiar with what to do and how to manage it. Every site has its own administrator or manager, and they are able to manage their own scheduling processes at site. They're also responsible for the capturing of the data and the reporting of the data at that point. And obviously, if it's done correctly, it is captured directly onto the EVDS. And the person who is vaccinated should receive an SMS immediately while you are still there at the vaccination site. So if you don't get that, then you should ask and press them at the site to capture that vaccination. However, we do know that there have been many that were not captured, and it creates frustration for everybody. So we have had specific programs to back capture the paperwork, and some provinces have done extremely well. Yesterday, I received a report that Mpumalanga has now finally captured all their paperwork. So that is an ongoing process. But it has been brought to our attention in particular sites that people have not received their SMSs with their codes. We are following up and will launch investigations, so you can bring that to the attention of the department through the call center so that we can follow up and make sure that you do get a code and are vaccinated. To prove that you are vaccinated. Thank
you. Foster, you mentioned that the other question had been answered. Maybe is it more in terms of the numbers? I don't have the numbers with me. I don't know if any of the colleagues have the number of health workers, but the second part, I'll ask one of the colleagues to maybe just come up with the actual number. But in as far as the question of compensation is concerned, we don't have such a scheme. If we can all remember that while it's quite sad for health workers to die through a disease which would probably have been contracted at work, because health workers are on the front line, as we have mentioned. We don't have a specific policy of compensation for any hazard at work in terms of whether it be COVID or any other hazardous exposure. The main thing is actually to protect, to make sure that our healthcare workers have the necessary protective equipment, protective environment, as much as it is possible to protect them against these hazardous illnesses. So it would be very difficult specifically, to have a scheme for a particular, illness, especially in terms of health workers. But I would ask I don't know if any of the colleagues have up-to-date numbers, either Dr. Anban or Nicholas, maybe they may have the numbers. Unfortunately, I don't have the numbers on my fingertips. Thanks, Foster.
Thanks, Minister. The last count in terms of the healthcare workers that had passed on as a result of COVID, since the beginning of the pandemic, which was in in March 2020. The total was 1,297, so close to 1,300 healthcare workers that had passed on, sadly, as a result of COVID. Thanks, Minister.
Back to you, Foster. If there are any other questions.
Yes, Minister, there are a few more questions. The other question, I don't know whether it can be answered here. Somebody's asking about the criteria used by SAPRA to identify about 2,000 children who are part of the vaccine trial for the children. I think there was the news yesterday that there will be vaccine trials for the children in the country today. So what is the criteria used by SAPRA to choose those children? How do they choose them? And what is the purpose of these trials? The second question is about the rumors. I think this one we've already answered it several times, Minister, about the impact of a vaccine on people, particularly men, to make children. Thanks.
Okay, we'll deal with that. I think it's a very important question. But let me leave Dr. Crisp and Dr. Pillay to deal with the trials conducted by one of the pharmaceutical companies.
Yeah, thanks very much, Minister. So all the trials on any medication go through various stages, and those stages are strictly controlled by ethics committees. They have strict oversights that are independent. But in order to get permission to conduct a trial, either just in our country or as part of a global trial, the regulator has to give permission, and there's a particular section in the regulator in SAPRA that evaluates the conditions of the clinical trial and may reject it or agree. And in the case of any trial, the regulator does not personally get involved in selecting anybody. The applicant for the trial has to explain exactly how they are going about case selection, case sizes, where they will be, exclusion criteria, and a whole host of other things. So it is not the regulator that selects the subjects, if you like, or the people who will be part of the trial. They have to be, usually in all trials, they would need to be healthy. There would need to be no other contraindications. And they go through very small numbers first, and then a slightly larger number for a second phase, and then a larger number before they go to full trial in the community. These are normal international protocols that are followed, and they are very strictly regulated, especially by our regulator. Thank you, Minister.
Yeah, maybe let me venture into the next question. We come across this quite a lot of times, the common kind of scare myths for especially our male, clients. The stories that if you take the vaccine, there's a risk that you can either lose your potency as a man. In other words, a risk of becoming impotent or being unable, to function sexually. Or in some cases, the myth is that either as a man or as a woman, you're going to become infertile, unable to bear children. We need to say again, this is the kind of false legend which is totally unfounded. There's just no relationship between any aspect of sexuality or fertility with any of the vaccines. And again, we want to assure all South Africans that there is no truth to any of these myths. Please come forward as a male. It's not going to in any way interfere with either your male potency or your fertility. And again, as a woman, if you take the vaccine, it's absolutely no impact on your fertility. So we hope that this kind of myths will be buried once and forever. Thank you very much, Facilitator.
Thank you, Minister. We have got the last two questions. The other one is talking about our foreign nationals who are from neighboring countries who allegedly cross the borders into the country, mainly to get a vaccine in South Africa, because in their own country there are some challenges. So are they allowed to do that or not? Thanks, Minister.
Maybe while we're going to deal with that, can I just ask Dr. Crisp just to update, because there's also been a matter of undocumented migrants. Firstly, maybe let's deal with the documented foreign nationals, the use of passports and other identification. I know yesterday when I was in the Northwest, somebody did ask whether a passport can be used. Maybe if Dr. Crisp could just deal with, firstly, the foreign nationals who are resident or working in South Africa, whether they can access vaccines, and then also the update on the work being done together with Home Affairs in terms of the undocumented migrants, together with the Human Rights Commission, how far we are with that. And then if he wants to venture into people who cross the border, you can also touch on that, but I can also just say something on that. Over to you, Dr. Chris.
Thank you very much, Minister. Okay, so to start off with, anybody who is in South Africa is covered by the prescripts of our Constitution, and as a health department, we execute the mandates of the Constitution and our laws. So we have a provision at the moment for any person who has any form of document to be vaccinated. So that includes South African ID documents, the birth certificate that has an ID number on it, any foreign passport, any authorized asylum seeker or refugee paper that has a number that is recorded by Home Affairs. All those documents, those people, provided they're within the age category over the age of 18, are able to be vaccinated, and that's the number that gets captured in the record that we use. We obviously need this ID number to be able to follow up for second doses and for any other healthcare that is required. So it's very important that it's consistent. Now, we know that there are a number, many, millions of both South Africans and foreign nationals who are in South Africa who have no form of identity at all. There are ongoing programs with the Department of Home Affairs to provide people with these ID cards and ID numbers, but there are backlogs, and we know that. But it's important from a public health perspective that we vaccinate everybody over the age of 18 at this stage, because that is our policy. So we want to vaccinate people who are undocumented. So we've had a program where we've been developing a health-specific identity that we can use now for this program for people who don't have a formal identity. And we will be able to use that number to ensure that we are able to give second doses or any other healthcare that's related. We are in the piloting phase of that document at the moment, and hopefully in the either next week or the week after, we'll be able to explain how this will work. Clearly, we'll need to manage this carefully, so we are likely to use only public health sector sites where we already have technology for the health patient registration system and number when we do roll this out. So in terms of people coming across the borders, there is a lot of movement across our borders on a daily basis. We have many, many neighbors, people who work in South Africa and who travel backwards and forwards for, to do goods and shopping in the country. If they are in the country and they come to us for vaccination, we will vaccinate them while they are here, because they constitute a public health risk to themselves and to us. So if they arrive at a vaccination site, nobody's going to ask them, are you here for a day or 2 days? We don't check visas and such things. We vaccinate people when they are here. Thank you, Minister.
Minister, we've got 2 more questions. Because we are doing well in terms of time, maybe I can pose these questions to the panel. The question is from Offenses Timo, SABC. Is asking if, as the department, are doing enough to inform the people who are coming for vaccination to first check the health status, including COVID-19 status, so that we are sure that the people who are vaccinating are not COVID-19 positive already. The other issue is directed to the colleagues in the Northwest. It's mainly talking about the outreach programs that we talked about. We are conducting the outreach program to encourage people to vaccinate. Someone is asking that, saying he or she has registered the mom on the 16th of July, only received the feedback this week, and is worried that this is not enough. Even though we've been saying several times that people don't have to wait for SMS, they can just register now and vaccinate immediately. But I'm not sure if the colleagues in Northwest, they want to talk about the issue of the outreach visits. Thanks, Minister.
Can we also invite the Deputy Minister if he feels like coming in on any of those? But I leave that to you and to Northwest. I'm sure either the MEC or administrator may come in. Thank you.
MEC, I can talk to this, but MEC, yeah, he's the champion of outreach in our province, so I'd like MEC to talk to this.
Thank you very much. Thank you very much, Minister. On the issue of outreach, like the facilitator has said, we do also have a problem where people do register and then they sit and wait for a message. But we've always told them that that process has been done away with. You register, just confirmation that you are registered. You can just take your jab immediately after that. Now that age is opened from 18 and above, anyone on those age categories who registers is duly allowed to take a vaccine immediately after registration. You do not wait for a message. That we've always explained whenever we go. But we do have an added component in our vaccination outreach program where we do outreach to rural areas. Remember, our province is rural. In that, when we do rural outreach programs, we do both the registration and vaccination at the same time. And whenever we go, we have a target of a minimum of 1,000 people to register and vaccinate. And also this we're doing, Minister, to also ensure that the coverage for the vaccine must not be biased to suburban areas. It must also have a bias to where people do not have necessarily access to many services, but vaccine must find them. In that mode of yours of vaccination and registration for election, our drive is that because during elections we say register to vote, even on vaccination we say register to vaccinate. Thank you very much.
Well, I see here on the question on the chat group, facilitator, MEC, somebody here is saying they are talking about somebody who is not mobile, whether there is possibility of home visit. Maybe you can just add.
Yes, Minister. There's possibility of home visits for registration and vaccination. We do have a team of community health workers and a team of young people who have been mobilized to do registration visits door to door. The second component is that whenever there are people who are in need of vaccination and they do not have transport, or we do not even want them to look for transport, we have arrangements with the provincial taxi council to transport people to vaccination sites. Yes, we're covering door to door, as I've said, but we're also covering a process of mass mobilization, including transportation in that regard, Minister? Thank you very much.
I think while possibly Deputy Minister may be getting ready to deal with the one of whether we do assist people to be checked before they get to, in terms of to avoid that they're already COVID positive and other ailments. I see, Dr. Crisp, there's a question about why we don't have enough Johnson & Johnson because many young people just want one jab. Maybe you could just explain that, and I'm hoping that Dr. Dhlomo can say something about whether we are checking and making sure people are not already ill with COVID and so on. Dr. Crisp can deal with why we don't make enough J&J, because somebody says the young people just want one jab.
Okay, thanks very much, Minister. Yeah, I think for everybody would prefer to have just one because it's more convenient and it means you're then done with it. But the fact of the matter is we had a global problem. The whole world did not get Johnson & Johnson vaccine for months while there was inspection going on in the manufacturing plant in the United States, in Baltimore. And then once that plant was then, or that process was over, we had to restart a lot of the manufacturing in other plants around the world. Now, our capabilities in South Africa is that we do have a fill and finish plant. It's been in the media a lot in Gqeberha, and that plant has been receiving what we call the source stock or the active ingredient from Europe, which is then used to manufacture the actual vials and doses that are going to be distributed. Now, getting that process going once more after the breakdown in the international distribution mechanisms has taken time, and there's been a lot of intense scrutiny on the processes, what they call good manufacturing process in those plants. We also had to compete in the beginning with a whole lot of other backlog orders, and our president went to intervene and make sure that we were not at the back of the queue, and has now managed through that process to make sure we do get Johnson & Johnson vaccine. But the short answer to the question is there's still only a small amount of vaccine coming onto the market, and so we are getting what we can. There were delays in the first two deliveries after the initial American produced vaccine that we received with the short expiry date. But we did receive vaccine during the course of the early part of this week, and there's another delivery due over this weekend. It's still small amounts. So we are using this vaccine to get to people and communities that are very hard to get to again. So for instance, the Northern Cape, where the distances are very far and it's expensive to send mobile teams out to farms repeatedly to vaccinate people, we would prefer to use Johnson & Johnson vaccine. And similarly in other rural areas. We are also using the Johnson & Johnson vaccine specifically to get to people in SASSA pay queues, because it also means that those mobiles only need to get to those queues once, and then the next month they can go somewhere else. Once we fully restore our supply of Johnson & Johnson vaccine, I sincerely hope it's going to be easier and quicker to roll out the program. But there's a level of patience needs to be executed. And right now, while we are anticipating a fourth wave at the end of the year, it would be very responsible for people to come in and get their two doses of Pfizer vaccine, because we have a large amount of stock and it's an extremely effective vaccine. So don't wait until you get sick, or you have to wait until there's maybe Johnson & Johnson available to you. I would really encourage people to come for the vaccines that we have now. Thank you.
You, Dr. Crisp, the Deputy Minister has agreed that you will try to respond to some of the questions as part of the closing remarks. Without wasting any time, I'm going to allow the Deputy Minister, Dr. Sibongiseni Dhlomo, to do the wrap-up and also touch on other questions that have been raised. Over to you, Deputy Minister.
No, thank you very much, Mr. Foster. Good morning to our Minister.
and the fellow panelists and some of the members of the Portfolio Committee of Health who have logged in, to the media and South African citizens. Just two other additional comments on the questions. Maybe Dr. Anban will help us in the future to really supplement this question of how many healthcare workers have we lost. 1,300 he mentioned. But as you probably recall, this was the first cohort of South Africans who were vaccinated, and we could probably even trace when we completed vaccinating our healthcare workers. Maybe if we could then look at the time we completed, how many more did we still lose? Anecdotally, it will show that there was a significant reduction in both ICU admissions and deaths of our staff members. Maybe that would be very helpful to actually get, and I know we do have that information, just that it is not really available now. When South Africans, when any mother gets to deliver a baby today or yesterday, they will know that they will not leave our premises until they've been given a BCG immunization. And they also get a card of indicating when they must come back for measles, mumps, rubella, or polio. It is also incumbent upon the health.
All right, we've got to quickly say goodbye to you. Have a good weekend, everyone.
Please take care, be safe. Simply is in tomorrow with Weekend Morning Live. We'll be back on Monday.
Bye-bye, everyone.
The situation in Afghanistan.